This episode of Nurses Saving Nurses is brought to you by the Center for Medical Training. The Center for Medical Training is a modern nurse aid training program that provides an enriched learning environment. The unparalleled teaching methods, flexibility, and efficiency of the program prepares participants for the next step in their healthcare career. For more information, please visit centerformedicaltraining.com. Welcome to the Nurses Saving Nurses podcast, where we discuss nursing innovation, entrepreneurship, and creative problem solving, addressing some of the issues that exist in our healthcare system. We're focused on solutions, not
All right, welcome everybody to the Nurses Saving Nurses podcast. I'm Nathan Barr, guest host for Adam Mencarelli, and I want to welcome Brent Van Haren, president of Secure Alarm.
Welcome, Brent. Thanks, Nate. I'm so happy to be here.
Thank you.
Love the work you're doing.
Yeah, thank you very much. I'll give the audience a little bit of a background. You're not a nurse. We've traditionally interviewed
my sister is. My sister is. I'm really close.
But connected, yeah. Yep. And but Brent, you and I connected really just through some mutual conversations related to workplace violence and the business community and clinical community here in the West Michigan area. So I was intrigued and really appreciative of the work that you're doing, being a non-clinician, but recognizing that problem that's so pervasive in the healthcare system. Mm-hmm. So if you wouldn't mind just giving us a little bit of a background on yourself and then maybe some insights into that work you're doing.
Yeah, I'd be happy to. Thanks. So Secure Alarm, I'll give you a quick background on Secure Alarm because that leads into my journey. Has been in the security industry for 30 years, founded by my father and his business partner, Gloria, who's still working in the business. And we were created to solve complex problems with professional solutions around technology to protect, space and environment, people, assets. And so we've been doing that for 30 years. And over the last 10 years, started to try to understand better what creates a safe environment. And 4 or 5 years ago, really came to the realization through education that technology is one important component, but doesn't necessarily, it just doesn't get you as far as you need to with training and awareness and procedure and accountability and so many other factors around safety and security. And in that journey, a couple of years ago, started diving into the healthcare space and learning. We've been providing security for healthcare systems for 25 years, cameras and readers and technology. But it was only a couple of years ago that as we started to dive in and understand what are the challenges, what are the outcomes that healthcare can focus on so we can take security from this reactive activity to proactive, it has just been shocking and eye-opening to really understand how much violence and how many challenges the healthcare systems face. It's a very unique environment. And those of you in it might realize it, but you might not as well because you're in it every day. But it's a very unique environment where there's so many different demographics, so many different emotions, so many different challenges, so many different cultures baked into one physical facility. Yeah. And it's a challenging place to begin with, and then with the increase in violence, but it's been there for years. The thing that was most eye-opening for me is how invisible it is to the public. Mm-hmm. As I've learned more about what happens in healthcare and what a challenging emotional and physical environment it is, it has just kind of blown my mind with what you all put up with every single day. And my sister's a nurse. She has been for, it's probably been 16 years, a pediatric oncology nurse. Wow. In LA, and then she was at the Children's Hospital, and just a couple months ago she moved down to Tucson. And watching her heart and how much she cares for her patients, knowing how much so many nurses care, and then realizing that as part of their job they have to anticipate and expect that there's going to be some form of abuse, whether it's emotional or physical, that's just part of the job. It's kind of lit a fire for us to help raise awareness and to figure out how the heck do we impact that.
Yeah. How do you mentioned too, the public's unaware of it, and being a clinical provider and having experienced it myself, having led crisis intervention programs and hearing from other clinicians. I mean, what was, I mean, how do we translate what clinical providers are going through to the public? I mean, it's hard. I don't even know. I don't know the answer.
Yeah.
How do you translate that?
The thing that really kind of floored me was through the numbers. That I think it was my data. I think this study was for 3 or 4 years ago. And so I don't know what the current data is. It's probably more. But the reported incidents of physical violence are like 40% of nurses have experienced some form of physical violence. And on top of that, they think only half are reported. And so a lot of those, what I've learned in the journey is that there's a much higher percentage likelihood of a repeat incident. If someone has been physically assaulted, they are much more likely to have that happen again. And so some of that is the same individual, but if only half is reported, that's like 60, 70, 80% of nurses and have experienced some kind of physical violence. So when you think about that me going into my office today, there is no part of me that assumes I'm just going to be in some way abused. Like it doesn't like that. If it happened to any of our team, if it happened to anyone on my team, I'd be furious. When our clients treat our team members poorly, we're parting ways with 2 clients right now because they treated our team with such disrespect. And to think about in the world that you all live in and that you came from, that's just part of every day, and you just assume it's going to happen at some point. That's the part that blows my mind. And it's like when you share that with people, I shared that with someone. It was this elderly man who we were just talking and walking, and he was like, I couldn't believe we were talking about healthcare. He's like, I couldn't believe there was a sign up about don't hit your nurse, don't hit your staff. And he's like, who on earth would hit their clinician? I'm like, you have no idea. I was like, it's like 60% of people have experienced it. And he's like, no way. No one assumed that because most people don't, but so many people do, reach some form of abuse, emotional or physical. And so for me, it was the numbers. And then when you add on to that, as you and I have journeyed, I learned so much from you, and I've learned so much from some CNOs in our area, that 1 out of 3 nurses for one of the healthcare systems we spoke with that's been in the industry for less than 3 years is planning on leaving the industry entirely, getting out of nursing in their first 3 years of being there because of the emotional and physical stress and violence that occurs. It's just kind of mind blowing.
Yeah, I mean, we talk about clinical workforce shortages, and you hit it on the head with the impact to early professionals and how maybe seasoned professionals have, good or bad, created a thick skin or datedness to some form of that, not justifying it, but those younger professionals haven't, and for those reasons and others, they're leaving the profession, and it is worrisome
so fast.
Yeah. And I think, like you said, because other work environments have that zero tolerance policy, and how do we? That's what I thought about. How do we get there? When I was in the healthcare system, how do you work towards a zero tolerance policy, and what does that look like? And it's
hard, right? The healthcare, like, there's so many different competing and conflicting interests in healthcare because everyone wants to serve. Like I know through my sister, I know through so many nurses I've met and clinicians. My brother is a pediatric neurologist and equally cares as much about his patients. But especially with nurses, he cares so much about helping people heal that it's easy to justify. But yeah, they were just having a bad moment. They were just having this. And then legislation, I think you're not really allowed to expel someone from the healthcare system if there's a history of mental health, and that compounds the issue. And so there's a lot of challenges to make it go away. But holy cow, we got to do better.
Yeah, I agree. So what are some of the things you're working on with Secure Alarm? What are some things that get you excited about this work you're doing? And then maybe after that, talk about how can nurses help you? How do we as clinical providers help you create solutions for us?
Yeah, gosh, those are really good questions, Nate. The work that we're doing right now, I heard from Brene Brown said this in, I think it was Atlas of the Heart. I don't know if you've read that, but it's a really good book. But she was talking about in this space, she's not trying to be the guide, just trying to be a map maker. And then I kind of look at that as our role right now. We're trying to raise awareness. I'm trying to engage with people at all different levels in healthcare systems to help understand what are what does help, what is going to lead towards reducing violence. And then I'm also trying to help unite. We are trying to help our clients focus on outcomes. And the big one in healthcare is driving down violence.
Yeah.
Security and HR and business continuity, like if you take those three departments, they're not necessarily aware of the overlap that they all have in their mission, right? If you look at security, if they're able to really protect and serve nurses and clinicians and just staff in general, and if the team feels safer, then that is going to help improve retention, which supports HR. If business continuity helps feed into that as well, and because emergency communication, that team is so good at communication. If they help put their energy towards listening and then problem solving on prevention, which is where I've seen a lot of gifts in the business continuity, business assurance teams, then that's going to help staff feel more supported and protected and be more supported and protected. And that also helps retention, and that helps business continuity, right? Because it's a little easier to focus on how to keep an MRI machine up, how to keep an OR opening when there's some kind of like physical constraint or power outage or something like that. You have to want to connect the dots between seeing that this turnover is going to impact business continuity more so than that acute incident of a water leak near an MRI machine or something.
Right.
And so helping people connect those dots is kind of where our focus is, to say, hey, if we want to drive down workplace violence, or if you want to improve retention, which all generates more productivity and profitability, like we can connect these dots, but you have to be willing to sit at the table and talk with each other about how your missions overlap and how you can share resources and collaborate and put energy towards achieving that common solution. So that's where we're trying to help. We don't know. Each healthcare system is so different, and the problem is so different in different areas, and so we don't know what is going to fix it in every instance. But we know it can be better, and we know that a lot of the energy people are putting towards their responsibilities can collaboratively improve the environment overall. And we know that we need better data. Everyone's tracking incidents of the healthcare systems. Not everyone can tell you. You and I talked. You taught me. As you and I talked about the data, you're like, you'd wager a lot of money that a lot of the incidents happen towards the end of a shift when people are tired and communication is down, and people just want to, everyone's fatigued.
Yep.
Or in that shift transition, the new team hasn't fully engaged yet, and so communication has dipped a little, and so people are getting anxious and frustrated, right? I haven't experienced anyone to know where the data is pointing to the problem. Like, what are the root causes that we can focus on, and so forth. So that's where we're trying to learn more than solve. And then once we're engaged in that kind of conversation, then we're trying to figure out how do we, the solutions, the energy, the expertise that we bring to the table, how do we actually achieve an impact?
Yeah. I think that's the awareness side, and it's something that, when you, as a hospital leader or even clinical provider, you're asking people to report, and then you report an incident, but you don't see a difference or a change, and that is really hard for a clinical
I bet that's pretty discouraging, isn't it?
Yeah, when you see that, but to your exact point, needing the data to, I think, accurately represent the prevalence of workplace violence too. So it's really, as I saw it, it's a hard message, but a necessary message is report. Make sure. But I was seeing non-punitive reporting and making sure that you're identifying right systems that can be corrected, and not trying to link it back to maybe the person specifically. But also just quantifying the totality of it, and it's hard to sit down and put in an incident report and go through. And so I think in the clinical community, as I've gotten away from it a little bit, from that hospital structure, one of the things I've been able to almost step back and clear my head and think clearly is, yes, the data is so necessary. And how do we tell how do we tell the stories? Stories are powerful. And how do we tell stories of what's happening in a way that can translate it to the general community, to, I think, the awareness, and then how do we write that maybe appropriate expectations on the political side.
Yeah, I think that, you kind of answered a big part of the question of what can nurses, what can clinicians do. It's to acknowledge that it's not normal. It's normal in healthcare, but we've got to do better as a community in reducing the violence. And if it's not reported, especially with the large healthcare systems, data drives decisions. And so if it's not being reported consistently, like, that's the last thing. I hate paperwork. That would be the last thing I'd want to do at the end of a long day, and especially if it was a hard day. That was the last thing I'd want to do. But without it, it's minimizing the problem. It's reducing the significance. That, and then helping contribute to. It's easy for me to say. I've not been in a healthcare environment, but I would say hold the team accountable for closing the loop. I think there is a lot of energy being put towards trying to solve the problem. I don't know if it's being put in the right areas. I can totally see, and I understand from, being a leader in an organization that's led a lot of change, I can see where and why not knowing if anything was done about a complaint or an issue I had can lead to discouragement. I've created that unintentionally at times where I didn't communicate well, even though there's a lot of energy being put towards something. So I'd say hold the team accountable for feedback. Hey, what is being done? How do we get engaged in the solution? And then I love, I hear that a lot in the military. There's this wonderful speaker who was in some really intense fighting in Afghanistan a year or two ago that I listened to, Clint Romashaw. And he talked about, he said, I'm an introvert. This is the last thing I want to do is be speaking in public, but that's all I do now. And people ask me why I do it. And he's like, because I care about the next generation. And if we're not telling our stories, then number one, people won't know how amazing the work that we do is. And number two, other people won't be inspired to get engaged and do the same thing. And so I think being vocal and sharing those stories, not from, as I say, not from a victim mindset, but it is literally, you're a victim of violence. So I think it might be a little inappropriate for me to say, but sharing that story, like, here's what we do, but here's why I do it, and here's why I'm willing to put up with it. But I'm not putting up with it not getting the attention it needs, but I am putting up with some patience to see the change now that people are putting energy towards it. Those stories are what's going to capture people's hearts and really accelerate the change, get that moving faster.
I completely agree. I think there's technological advances that you look at, artificial intelligence and voice recognition softwares, and you wonder, is there a way to capture the prevalence without having to document it? Is there a way, you can do the text, and does that look like a device clinicians wear that recognizes, harsh communication and tones, verbal abuse? Is there a way to do a vocal report of an event? Things like that. I think that as we see technologies advance, could present some cool alternatives to the traditional sit down at a computer and type in your incident report, or fill out this paperwork and submit it to risk management, things like that drive clinical providers.
I love that, Nate. I mean, you hit on something that would help. That is one of the things that the healthcare systems can do first, because that's what I'm trying to bring ideas to the leaders and the healthcare systems on what can you do. And I love, it seems so simple, and it is, and it's so important. Simplify the act of getting the information. If the nurses and the staff just had to verbally record the report and someone else would turn it into a written report, gosh, I bet that would improve and increase the number of incident reporting significantly. And I love we're in the technology industry, like our world in security. People don't probably think it when they think about security, but we're right at the intersection of technology. We're really a tech company in construction. It's this fun place to be. And so we love technology. The humbling realization we had about 6 years ago is that technology isn't the answer. it can contribute, it can make things easier, it can have a wonderful impact, but without human engagement,
Yeah.
then the technology just has a fraction of the impact. And so, and that's hard for any organization, I would say, especially healthcare,
Mm.
to acknowledge. You know, it's a little easier to write a check to solve something than to convene a group of really, really busy people and say, hey, we're going to devote 20 hours or 30 hours to figuring this out over the next 3 months. That's harder in a lot of ways than writing a check, even though, you know,
Yeah.
budgets
Yeah.
matter and everything. And so I love the idea of technology, but it has to be it has to be combined with hearing from people. Will this really help? Is
Yeah.
this gonna have an impact? And if so, then let's measure the impact. If we're gonna simplify, if we're gonna have you just dictate what happened and someone else is gonna transcribe it and put it into a report, then we expect incidents to increase 30%, incident reporting rather, to increase 30%. Then let's make sure that happens. That's where we're trying to help lead with outcomes rather than just activity.
Yep. Yep. No, great stuff. Great stuff. Well, we're about time here. Thank you again, Brent, for joining us and for providing your insights. If a nurse or any of the clinical community wants to connect with you and provide their insights on workplace violence or other opportunities, how would they get a hold of you?
Yeah, I can give you my email address and my phone number, Nate, my cell phone.
Okay.
And that would be fantastic. But yeah, bvanheeren@securealarm.com, and I can give that to you so people know how to
All right.
spell it out. But yeah, because there's no E in Secure Alarm. So BVANHAREN at Secure Alarm, SECURALARM.com.
Awesome.
But I also just want to say thank you. I brought my sister to the first Nurses Saving Nurses event, and it was a little emotional for me just sitting there and listening and seeing the work that you're doing, and taking a step closer to understanding the environment. Because all I hear from her is about the patients and the work that she's doing, and you know, the kids that are being healed, and then, you know, some that didn't make it. And it was different hearing the challenges and the fight that she pursues every day that is invisible to those outside of it. And so thank you.
Yeah.
Thank all the nurses and all the clinicians and all the staff that are out there doing this every day. It is it's amazing the work and the calling that you all participate in. So thank you.
Awesome. Thanks, Brent. Thank you, everybody, for listening, and stay tuned for our next episode of Nurses Saving.
Thank you for listening to Nurses Saving Nurses. Follow us to hear more exciting content and innovation occurring in the nursing world.